All right, so this discussion topic is
Family value-based approach to transitioning a loved one home. This is something that we're all passionate about.
yeah. It really changes the way that I think I see people receiving treatment and how it's not a person receiving treatment, it's a family receiving treatment. And it takes away a lot of the issues that we see in households where a person feels isolated from their family. Your family unit should be your team. That is where the unconditional love lies in most cases. Of course, some cases are very different and people have different circumstances. But having that core place where you can just fully be yourself, you know these people have your back no matter what, and you guys can all align on the same things that are important with the family, then you can really grow and make sure that no matter what people are doing, if they're living a different lifestyle or they may not be the same as their parents, but their core values are the same, that they can really bond and not feel so segregated and separated in their beliefs. But you've got to dig deep in family therapy and working as a family unit to find those commonalities amongst the different members of the family so that you can feel like you're a part of something bigger than yourself and that you're not alone on your healing journey.
I mean, in so many situations when we dig into the whole family, there's the identified loved one, the identified person of concern. However, it's easy. They can go, well, look at you, look at you, look at you, because everyone has their things and everyone has their things that they brought to the table that have created this whole dynamic within the family. And this person just happens to be the one that's like standing out, right? I know in my family unit, I was the obvious one, right? But when I got better, everyone else had to take a look at themselves and get better too, right? So it takes away from like, you're the one that needs the help. No, we all need help and let's all do this together. And when we go in with that kind of mentality, the lasting change is created.
If one person always thinks they're the presenting problem, then they're not going to involve their family in their recovery. They're going to run from that because they feel like they're the black sheep. And so if you can normalize it, okay, they're struggling now, but the family unit needs to heal together. When other family members make themselves vulnerable and are able to admit to that and say, look, this isn't just you, this is all of us, I think it also sets a really good example. Because I can think of so many times where it's been the opposite. Patient comes in, they're like, I'm being forced into treatment, but why don't you ask her? She drinks every single night.
Right.
Or look at what he's doing. He's out gambling. It's just not you have to all be able to say, look, I'm willing to take a look under the hood and let's get better together.
Absolutely.